you're gonna be grossed out. This is for patients who need to be suctioned and there's no suction source. I would do this for my own child, but that's it.
Oh, you are not gonna suck that thing.
Yep. In the airway, suck with the mouth. They
That's
put
not
these.
so good
They put
for-
these in the patient's go
They don't even have a
bags.
HEPA thing on there. HEPA filter.
Okay. They put these in here for parents, basically.
Okay.
Oh,
Okay.
okay, yeah, any mom would do
It's
that.
Yeah.
a go bag. You would do it for your child.
Right,
You know, you would.
yeah.
You're not gonna let
Oh,
your kids
one
sit
of our
there and
parents,
die.
right.
No, I don't
Right.
know. Your boy might have something really serious.
I know
Like
that.
his germs.
I know that. But
Yeah,
guys,
but-
if you ever hear of a DeLee suction catheter, that's what
DeLee.
it is. Now, the theory would be, seriously though, you're applying suction and the secretions stay in the little tubing. Now, I'm sure you still get exposed to a little bit. But the reality of it is, if mama's at Walmart and her suction, all of a sudden, her portable suction goes dead or it clots, and her kid needs to be suctioned, I can promise you, I'm gonna pull this out and suction my kid.
Yeah.
Or my mama.
Right.
You know, that's all it is. But I just want you to know what it is. If you ever go, what's a DeLee suction? A DeGrosse.
So how about that? So if we're in there and then it goes down, you can go, get up, I need you to suction this.
If the suction is like, yeah, I would be like, Mama, you got to get up. Okay. This is your sputum collection cup. Every one of them at every hospital is different, but they basically all do the same thing. What is going to happen here is your suction tubing that comes from the wall is going to connect here. Your suction catheter that we're about to use is going to connect there. If you were using a Ballard to obtain a specimen, then you would just stick the Ballard into here,
Okay.
okay? To truly get a true sterile sputum sample, though, you should use a sterile catheter, okay? So you would connect the tubing here, and you would use the same procedure. You insert the catheter, but then as you're pulling out, any mucus that you pull gets stuck in the cup, and then you send the cup to lab. Be careful, the ones they have at Tulane are a test tube style Lukey tube, and if you turn them the wrong way, you lose your sample. So be careful of those when you're at Tulane.
Not on
Or
the
at
stove.
other
Okay,
hospitals.
how you use
No, it turns to where it goes right into the suction
Oh.
tubing, so you
Oh,
just lose the sample from the ball.
I'm gonna call on it.
Okay, so we'll learn, I mean, doing sputum collection is just kind of one of those things that you have to do it to really know how to do it. Okay, so what is your checkoff? Kind of all this stuff that we've been talking about suctioning is fair game, but your actual checkoff is to truly do a sterile suction. All ready? Okay. So in this kit, it is going to tell you it has one folding basin, 2 vinyl gloves, and 1 suction catheter. This is truly considered to be a sterile catheter kit. Everything in here is sterile. Now, once you open it and put it on and then shove it down the patient's airway, it ain't sterile no more. But it's still what we consider to be aseptic or clean to an extent, meaning we're only giving the patient back their secretions. Okay, so your checkoff next week is to answer all the questions I have about suctioning, but also to be able to put on your sterile gloves. You need to know how to put on sterile gloves. I don't want you to look at me and go, oh, I'm going to only work at a hospital that uses Ballards. What if they run out of Ballards? Also, what if the physician says, hey, I need you to come assist me. You got to put on sterile gloves. And there's going to be times that happens, where you may have to assist a physician and you have to have sterile gloves on. You need to know how to put them on. Okay, so when you open it up, your sterile suction catheter kit, it always has the flap. Okay, you want to open it where the plastic side is down. Okay, notice the first thing on top is your sterile basin. I'm going to pick my sterile basin up where I'm not touching anything, and I'm going to pop it open. Notice I didn't have to shove my finger down in it. You just pop it open. Don't touch the inside. You want the inside to stay sterile. You're going to set that down. You can either throw some saline, so you can open up a couple bullets of saline and shove it in, or if you have sterile distilled water, whatever. Most kits don't have that basin. Why would you need that? Because if you are suctioning that patient who does have the really thick, gooey secretions and it clogs up your suction catheter,
You have to dump it.
you put the suction catheter in, apply suction, and it rinses the catheter. it sucks all that water up until it clears the clot of mucus or the booger.
So you say you feel the sterile water or sterile?
Either one is fine, yes. Sterile water. The book says sterile water. Notice on the list. But in the real world, we just put some saline in it. Because the saline, in theory, is sterile in the bullet. Okay, so that was your bin. Just make sure you ain't shoving your finger down in there. Okay. The next thing you're going to notice you have is your gloves. Okay. So you have 2 gloves. You want to try to just pull one out. I did kind of let that one fall on the table a little bit. You want to try not to do that. When you look at your gloves, you got to figure out what's the thumb side and what's the pinky side. This is actually the thumb.
What? That thin?
Okay. Notice your glove is cuffed. Okay? Right now, my hands are technically clean. Some people have regular gloves on and then they put sterile gloves on top. I just think it's too much, maybe because I have big hands. I guess if you have tiny hands, it's okay to do that. It's just too much for me to have 2 pairs of gloves on. So the first one you put on, you are only touching the glove on the inside. Does it make sense that if you uncuff that, I'm only touching the inside of the glove?
Right.
Okay, so by touching just the inside of the glove, I'm going to slide my hand into my glove, still only touching the inside. Y'all see that? Okay, if I need to adjust it, I'm only touching the inside. Okay, so first glove, touching it only by the inside. But now this hand is sterile, right? So if I do this,
It's a problem.
it's a problem. If I do this, it's a problem. If you touch anything, the glove is no longer sterile. Do you want somebody shoving that down your airway?
No.
No, you don't. But the biggest thing now is I have to change it up because now I want to touch sterile to sterile.
So that-
If I grab this glove the same way with the cuff, then I'm going to touch my skin as I'm pulling it on. So now you want to touch outside to outside. So now I'm grabbing this glove the opposite. Melanie must have done this before. She's doing the hand motions. So do you see that I'm touching sterile glove to sterile glove? So now when I put this glove in, there's no risk of my skin touching the sterile parts. So same thing. I'm going to put my glove on, and I never touched my skin. So now I've got both sterile gloves on. If you need to adjust, you can only adjust by touching the outsides. You can do this, all of that. Both hands are sterile. Are we okay? Now that I got both sterile gloves on, now I can get my catheter. Okay? It's not always going to come in a little plastic baggie, but some of them do. This is a big catheter. This is a 14 French. One thing you'll notice about 14 Frenches is they're not very flexible. They have good rigidity. Most people suction with their dominant hand. I'm right-handed, so I'm going to show you my way of doing things. If you're left-handed, do it however you want. Your end of the catheter needs to go in your dominant hand. Okay, so notice I have the very tip of the catheter, put it in my dominant hand, and then what I do is I just kind of wrap it up a little bit to keep it kind of protected and to keep it in. Okay, because if I leave it like this, it's too much of a risk of me touching something with it. So I wrap it up. Now I've got to do what? What do I need to attach to this?
That's suction. I mean,
The tubing. Good, the suction tubing. That suction tubing has been on the floor, in the bed, and everywhere else. So once I grab my suction tubing, this hand is now my dirty hand.
okay.
I attach my tubing, trying not to touch this. So a lot of people will pretend like this is clean. A lot of people want to wrap up like this. That's wrong, because now there's too much risk of you getting the catheter dirty when you touch the tubing. So you want to wrap to about right there. Does everybody see? Damn, I'm getting recorded on 2 things?
Yeah, I just wanted to know.
I don't have your mace, I just have your hand.
My phone went deep. My phone went deep.
You remember, I used to do that before.
Okay, I'm like, damn, I'm getting a double record. Okay, one for evidence and one for learning, huh? Okay, so once you pick up that tubing and attach it, this is now your dirty hand. So you wanna try not to touch it. Now this part, guys, is called your thumb port. That's where your thumb is gonna go to apply suction. When the thumb is off, that just means that basically the tubing is sucking room air through that hole. When you occlude the tubing or the port, now the vacuum coming from the tubing is sucking the tip. Okay, so you only want to occlude the port when you want to suction. Are we good? Okay, so at this point in time, we're going to pretend that my assistant Tiffany has been bagging my patient, right? Go ahead, since your recorder don't work. Okay, so she has been pre-oxygenating, hyperventilating my patient while I get all my stuff together. So I say, okay, Tiffany, I'm ready to suction. So Tiffany is going to remove the bag from the ET tube, okay? She's going to hold the ET tube for me, but not the way she has it, because she's pointing it straight at me. She's going to point it up at the ceiling. That way it don't hit you in the face, and it don't hit me in the face, and we'll all be happy at the end of the day. Okay, so at this point, I've unwrapped my catheter. I am now putting my catheter down my tube, okay? So we'll say I've hit my obstruction, I pull back 1 to 2 centimeters, and I go ahead and apply suction, and I